I'd like to call the regular meeting of October 8th, 2018 to order. Roll call, please, Donna.
Here.
Here.
Present.
Here.
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 All right, we're going to be led in the Pledge of Allegiance tonight by Troop 627. Young men, please stand. Thank you very much. Appreciate you joining us tonight. I will open the floor for public comment if anybody would like to address the board about a matter that's not on the agenda tonight. If not, you'll have another opportunity at the end of the meeting. I would like to thank Trustee Balmas for filling in for me for a couple of meetings. I've had a rough travel schedule, so thank you. We'll move on to approval of the consent agenda as presented. Do I have a motion to approve?
Second.
Motion by Trustee Balmas, second by Trustee Garner. Roll call, please, Donna.
Aye.
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 Yes.
Yes.
Aye.
All right, motion carries. Patrick, please read the consent agenda into the record.
Item number 1, approval of the minutes from the September 24th, 2018 Village Board meeting. Item number 2, approval of request from Utility Division to purchase 12 Census Omni C2 compound water meters from Corn, Maine at a cost of $20,688. Item number 3, approval of payroll for period ending September 28th, 2018 in the amount of $840,754.03. Item number 4, approval of bills for period ending October 8th, 2018 in the amount of $585,397.49.
Thank you, Patrick. Do I have a motion to approve the consent agenda as read into the record? Motion by Trustee Garner, second by Trustee Ross. Roll call, please, Donna.
Aye.
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 Yes.
Yes.
Aye.
All right, motion carries. Petitions and communications, we have a proclamation for Fire Prevention Week, October 7th through 13th, 2018. The Village of Gurnee is committed to ensuring the safety and security of all those living in and visiting the village. And fire is a serious public safety concern, both locally and nationally, and homes are where people are at the greatest risk from fire. And roughly half of all residential fire deaths result from fires reported at night between 11 p.m. and 7 a.m. when most people are sleeping. And according to NFPA research, working smoke alarms cut the chance of dying in a fire in half. And Gurnee's first responders are dedicated to reducing the occurrence of home fires and home fire deaths and injuries through prevention and proper education. And the 2018 Fire Prevention Week theme, Look, Listen, Learn, Be Aware, Fire Can Happen Anywhere, effectively serves to identify basic but essential ways people can reduce their risk of fire and be prepared in the event of one. Now therefore I, Christina Kavarik, Mayor of the Village of Gurnee, do hereby proclaim October 7th through 13th, 2018 to be Fire Prevention Week throughout the Village of Gurnee, and encourage all residents to take the time to look for places fire can start, listen for the sound of the smoke alarm, and learn 2 ways out of each room. Do I have a motion to approve?
Motion to approve.
Motion by Trustee Thorstensen, second by Trustee Ross. All in favor say aye.
Aye.
Opposed? All right, it's going to be Fire Prevention Week. Our next proclamation is for Red Ribbon Week, which is October 23rd through 31st, 2018. The theme this year is Life is Your Journey, Travel Drug-Free. The Village of Gurnee values the health and safety of all our residents, and alcohol and other drug abuse in this nation has reached epidemic stages. And substance abuse is particularly damaging to one of our most valuable resources, our children, and a contributing factor in the 3 leading causes of deaths for teenagers: accidents, homicides, and suicides. And local leaders in government and in the community know that the support of the people in the neighborhoods is the most effective tool they can have in their efforts to reduce misuse of alcohol, tobacco, and other drugs. And the red ribbon was chosen as a symbol commemorating the work of Enrica Camarena, a Drug Enforcement Administration agent who was murdered in the line of duty and has come to represent the belief that one person can make a difference. And the Red Ribbon Week campaign theme promotes family and individual responsibilities for living drug-free lifestyles without illegal drugs or the illegal use of legal drugs. Success will not occur overnight. Our patience and continued commitment to drug education and prevention are imperative. Now, therefore, I, Christina Kovarik, Mayor of the Village of Gurnee, do hereby proclaim October 23rd through 31st, 2018 as Red Ribbon Week in Gurnee, and the village encourages everyone to wear and display red ribbons and participate in drug-free activities throughout that week, joining the rest of the country to establish an atmosphere that supports awareness, education, and ongoing initiatives to prevent illegal drug use, and be it further proclaimed that the Village of Gurnee does hereby urge all citizens to pledge, life is your journey, travel drug-free. Do I have a motion to approve? Motion by Trustee Balmas, second by Trustee Garner. All in favor say aye.
Aye.
Opposed? All right, it's going to be Red Ribbon Week. Thank you. Next item on our agenda is a presentation by the United Way of Lake County regarding the 211 program in consideration of a contribution request in the amount of $10,000 from the Village of Gurnee. And we have Deanna with us tonight to kind of walk through it. This was at my request. Our County Board Commissioner, Steve Carlson, who is also in attendance, kind of brought it to me that this initiative was underway in Lake County, and it really resonated with me, and I think it'll resonate with all of you. One of the things I struggle with as mayor, and I know Donna struggles with as the executive assistant, and Pat and Jack, is we get phone calls from our residents, and they need help, and the village doesn't provide social services, and the village doesn't always know where to send that person for help. So when I heard about the 211 service, I was very excited because I think it'll add a lot of value for our residents for a nominal cost as seed money to get started. So I'll let Deanna introduce herself and tell you about the program broadly. Thank you. Welcome.
Thank you. Good evening, everyone. I'm Deanna Ullman from United Way, and I'm so pleased to be able to present here today to you all about 211, a program that United Way has been working for over the last year to implement in Lake County. We know that today, Find Help Lake County, an online resource database, assists 35,000 residents of our county each year in finding resources. However, being an online resource, it isn't able to provide individuals without access to internet assistance or those that might need a little bit of extra assistance navigating both resources that might be available and the issue at hand that's affecting them. 211 is an easy to remember 3-digit number that anyone can call 24 hours a day, 365 days per year, very similar to 911, but that focuses on health and human services. This resource, once implemented, can assist those that aren't able to navigate resources themselves or might not be able to access that online resource in breaking down those barriers to access and navigation to get the help they need. This, in turn, we know will reduce misdirected calls to your organizations and many others throughout the county, allowing them to focus on their mission-oriented tasks every single day instead of re-navigating individuals to other resources. We also know that this can help us understand needs in the community and further our impact. So as I mentioned, 211 is a connector to health and human services. So from this slide, you can see all of the different resources that will be collected in one centralized place, just like Find Help Lake County does right now. But in addition to the resources we currently collect, 211 is also going to add in disaster assistance. And being in the Village of Gurnee, I'm sure you guys are very familiar with disasters, with flooding and other things that have occurred here. And 211 is very well suited to assist individuals navigate the crisis that they're experiencing from a disaster, as well as finding those resources. So each year across the country, communities all across the country experience disasters, whether it be hurricanes such as Florence we just experienced in North Carolina, or Harvey and Irma last year, as well as Maria, or the wildfires out west. Each community eventually is going to experience a disaster. 211s are there to support their local communities through the resources that they collect every day, and also as a resource to monitor those new and upcoming resources. So imagine if there was a flood, 211 would readily collect information on where individuals could find sandbags, where evacuation routes might be if it was anticipated to be severe, shelters that were opening to help people leave their flooded homes, or where to even put their garbage. 211 has been doing this all across the country. They're also trained in crisis as well as other types of certifications that assist them in meeting the needs of the residents that have experienced a disaster. So whether it's a mental health issue or something even more severe, they're able to assist them. So when someone connects with 211, they're going to reach a live person, just like in a 911 call. That person, as I mentioned, is trained in crisis and a variety of different other certifications that help them to understand what that individual is going through, help them navigate the problem at hand. Problems are complex. You know, someone might call for food, but in reality, there's a variety of different other factors that are making them call that day, whether it's a job loss or they're experiencing homelessness. So they're going to help them navigate that first issue and then look at some of those root causes. They're going to then help the individual understand what resources are available in their community. So is there a local nonprofit that might be able to help? Is your local government? But sometimes it's something in their own back pocket. Maybe they haven't talked to their landlord about making a rent payment plan, or their utility provider about assistance that might be available, or speaking to a parent or a loved one about helping out for a temporary status. So we know that 25 to 35% of individuals that do call actually solve their concern with their own personal resources rather than a government or nonprofit resource. But if they do need that assistance, the specialist is going to make a plan with them on how to reach that organization. If needed, they might do a warm transfer and help that person navigate the call with that organization and make sure the problem is resolved. At the end, they're going to hang up, and then in a couple days, they're going to call them back to make sure that problem was resolved. If not, they're going to start the whole process over to make sure, again, that problem is resolved and no other needs exist. We know in this day and age that not everyone wants to make a phone call. In fact, texting is the most popular form of communication now. So we've ensured that our 211 system will accommodate not only phone calls, but still our website, as well as live chat, text, and email, all of which, again, will be 24/7, 365 days per year. We also know, of course, that our county is diverse and that we have a need for multiple different languages. So our specialists are going to speak English, Spanish, and Creole, just in case we have any Creole speakers in the county. And we'll also have access to a translation line with 140 different languages in addition to those that the specialists already speak. So we should have everyone covered. One of the coolest things about 211 is that it provides live public data on needs that are coming into the 211 Center. So this is a snippet of one of those data tools, which is called 211 Counts, and it is live in basically every other state right now but ours. And you can see that in Wisconsin, there were a variety of different top categories of needs, with many of them being housing and shelter. Of those, you can look at subcategories. So what type of housing and shelter assistance did they need? Was it rent and mortgage assistance? Were they looking for subsidized housing? And you can narrow this down by cities, zip codes, congressional districts, and even school districts. So this is something that will be available to us and is used very often actually during disaster times. So as I mentioned, that 211 Counts dashboard is available basically in every other state. And that's because 211 is seen as part of the infrastructure of every other state essentially in the country besides Illinois and Arkansas. So we are lagging very far behind in covering 211 for our residents. In Illinois currently, the Chicago metropolitan area is the only metropolitan area in the entire country that does not have a fully covered 211 system. The state overall has less than 30%, and obviously in Lake County, we have no coverage whatsoever. We understand that 211 can't be implemented just through the work of United Way. As Mayor Kovarik mentioned, we've been working very closely with Commissioner Carlson from the Lake County Board and many others throughout the county, from nonprofits, governments, local businesses, other townships and municipalities, to determine how to best fund United Way. And this is a current picture of all of the different businesses, local governments, and individuals that have helped to financially get 211 to a point where we're almost able to launch. We are very close to getting to that point, and I'm going to turn it over to Steve to tell you a little bit more about what's going to happen tomorrow and how you as the Village of Gurnee can help. Thank you.
Thank you, Deanna.
I can't match her eloquence or professional presentation here, just to say that I'm proud to be here promoting or supporting United Ways 211. This has been a project that's been ongoing for a couple of years. They had to raise some money. They will raise some money, and I could tell you tomorrow, unless I'm very surprised, we'll have a unanimous vote to the tune of $80,000 to support United Way 211 from Lake County. This is something Lake County should be up there, and it will be tomorrow. And I hope that this board will consider the presentation and the ramifications of this and the impact of this, and continue to be a leader in Lake County as you have in so many other instances. Thanks for your time.
Thank you. And again, I really wanted to bring this forward. It's outside our scope in general of the services that we provide. But it's a very valuable service for our residents, and I know some of you, but myself and Pat and Jack and Donna, and I know our officers, police and fire, we all have multiple stories where we're exposed to a situation or someone calls us, even the building inspectors, I've heard from them, where we have residents that are struggling, and to get through, figure out who to call, where to call, whether they're going to get a call back, or they often don't call, and then it becomes a crisis. And once that crisis starts, it is so hard to dig out of it, where if there had been some assistance in the beginning. So I can tell you how many times our hearts have been broken by not being able to say to someone, here's where you can go for help. There's so many different situations. I think this would be extremely valuable for our residents, for a nominal amount of money, that a service that can be provided for everybody in town, no matter what the situation is. There's some place they can call, someone's going to keep track of it, do a warm handoff, follow up with them, and we know our residents are getting the help that they need.
I can't help it. Two other aspects to this.
Okay?
One, and Deanna mentioned it, but I call and I need help with my rent. Well, why do you need help with your rent? I just got fired. Why did you get fired? I'm addicted to opium, whatever. So you have a live person that follows up, okay? The other thing that she mentioned was the database. The beauty of the database, it can prove need, which helps you with any kind of grant application you might have in the future. Two things I thought I'd mention.
Hey, and this is just an initial contribution. There's a lot to be worked out once this is up and running, as going forward, how the funding will work and what other the contributions will be ongoing. So this is a one-time only to help them get up and running. But I think it's well worth it for us, and it becomes a response that we can, response that we can use, whether it's our police or fire, whoever in the village, me, Donna, any of you, get a phone call 211. So I know you have some questions. I didn't have a chance to talk to all of you before this got put on the agenda, so who wants to go first? Trustee Balmas?
One of the questions I had was, so this initial comes up, how is the funding going to carry on from here? I mean, is this how it's going to operate? And then my other follow-up on that is, have you got coordination with area organizations like Love Inc. and several others? And do you do the background checks on people? All of that comes into play.
Great questions. So right now we have a 4-year budget for 211 where we've projected our expenses and are working on filling in the revenue. For our first year, we're about 84% funded. Tomorrow with the Lake County Board vote, hopefully we'll be close to 100% funded. And then we're working on years 2, 3, 4, and 5 currently. We are working very closely with our corporate and business partners, individual givers, local townships, county government, even nonprofit organizations to secure funding needed to help support 211 in the long term. One of the first things that we did when we looked at this initiative is said that we're not going to launch or even set a launch date until we have 100% of the funding or more for the first year and 50% of the second year. So that's what we're working to achieve right now. In terms of working with other organizations, we currently have a list of supporters of 55 different organizations and individuals in Lake County from a broad range of sectors, including those nonprofit organizations, everything from domestic violence to crisis to heroin and opioid and behavioral health organizations, local fire districts, local police districts, different legislatures in the community. We're also working on pulling together a task force of those various different stakeholders on a range of issues related to implementation, such as marketing, community engagement, service delivery, evaluation, fundraising. So we'll be looking at all those different stakeholder groups and making sure we have wide representation from across the county to ensure that all of those voices are heard in how we implement this program. I believe your last question was on background checks. If I'm understanding correctly, kind of how do we screen individuals for services they might be eligible for? Is that what you're looking
Yes.
for? So all of our resources that are in our Find Help Lake County database, which will transfer over to the larger 211 system, has very specific information on what makes someone eligible for service. So each program in every organization sets their own eligibility, and we'll be looking at that eligibility and matching it against the individual's income, age, geographic location, whatever it may be that we need to double check and make sure that they're eligible before referring them over to the service. In order to get the service, they would of course have to go through the eligibility application or intake, whatever it might be at that specific organization. Does that help?
Yep, thank you.
Trustee Garner?
I just had a comment. You know, it's so true. It's so difficult to help people who are in need. I mean, most of us, when confronted, we really don't know what to do in the moment, and it's just kind of nice to have a resource that people in need can go to or that we can direct them to. And I just believe that, you know, people who can ought to help people who need. And here's our opportunity to do that. And I just hope that we will do something for somebody else because we can.
Thank you so much. I couldn't agree more. And one thing that I didn't mention is that 211 also allows individuals looking to volunteer or donate to match with organizations that are looking for volunteers and donation opportunities. So another great example, recent disasters that we had, a lot of people wanted to donate a lot of things. And sometimes that's a good thing, and other times it means, where are we going to put this? How are we going to store it? How are we going to distribute it? So during those times, 211 can match those organizations appropriately and also prevent people from donating, hopefully, that otherwise would have just caused a bigger mess for us, the second disaster, as it's called. And during the off seasons, when there isn't something crazy going on in our community, we can, of course, just do regular volunteer and donation matching.
Trustee Thorstensen?
Well, first, we've obviously been hearing about the increase in addiction and mental illness, and some of these services that you're going to offer, I think, will be well needed, so I appreciate that. So I have a few questions.
Sure.
If you want to give, I'll give you a couple. So does United Way manage this service throughout the country?
In almost every circumstance, yes. So there are some 211s that are not managed directly by a United Way. However, almost every single one is funded largely or in part by a United Way. Nationally, United Way Worldwide is a leader in 211 efforts and is working to help consolidate 211 centers that are in smaller communities to work on economies of scale that the larger 211 centers are able to provide communities. In addition, they're working on data quality, showing the nation the results and needs that are shown through 211, and setting best standards and practices with the Alliance for Information and Referral Services, which is a larger organization looking at information.
So then you do have a pro forma or a program that you're rolling out essentially from the other applications that have already rolled out?
Yes and no. So what we've done is looked at the best practices in 211, and we've learned from, quite frankly, some of the mistakes that others have made in not marketing, not working with local stakeholders, and we've worked very hard to do that from the onset of this program. There are some 211s that don't market, they don't have a call volume, so we were working very heavily in that area, and also working with 211 specialists that have additional training kind of beyond the basics. So we're going to be looking at a 211 that's more enhanced than many local communities see that do have 211 in our state.
Just a couple more. Do you have a board that includes government entities or that would give you guidance on, since we manage 911 and others do as well?
We have our United Way Lake County Board that oversees all of our operations. In addition, we have a task force that's currently been created specifically for 211 around fundraising. We're in the process of revitalizing that task force to include a range of different stakeholders from all of our different funder groups, and county, township, and hopefully local municipal representatives, including nonprofits as well, will be on that board. And it will be an advisory council from our United Way Board.
I guess what I'm looking for is not just the advisory on the fundraising, but on the running of the operation.
I apologize, I should have included that as well. So within that revitalization will be the focus on the marketing, community engagement, service delivery, evaluation, in addition to the fundraising. So fundraising will be a small piece of the overall.
And then I guess one last one. You talked about warm transfers, and I'm familiar with that. So all of these services are phenomenal, but does that mean that you have their commitment to have staffing 24/7?
Yes, absolutely. So there is a team of about 68 individuals that work in the call center full and part-time. And then we also have a team that's on call, specifically within that area. And then 211 centers across the country, when there are large spikes due to disasters or other crises, come on board and help out the call centers as well. So for example, in Hurricane Florence, there were of course, the call centers in North Carolina and South Carolina that were assisting individuals, but then call centers as far away as California picked up and were able to assist with the overflow calls, and usually actually texts that are coming in.
And that includes warm transfers to the services locally, though?
Correct, yes.
Okay, thank you. I really
Absolutely.
look forward to it.
Thank you.
Trustee Jacobs?
Thank you. Again, like echoing everybody else, I think this is a great thing, and I'm happy to see that you're waiting to see like a 5-year plan of sustainability with proper funding before you roll this out. But my question is along those lines, is there a goal for long-term sustainability, beyond that 5 years? I mean, what's the track record outside of the state of Illinois? Obviously, you've said that besides Arkansas and Illinois, these 211 centers exist in pretty much everywhere else. I mean, what do they look like for sustainability elsewhere? Can you explain that?
Sure. So the concept of information referral has been around since about World War II, when veterans were returning home and they needed resources. From that start, local offices opened, and through the years have obviously formalized into 211 as it exists today. We are only aware of a few 211 centers closing, and that's usually because of consolidation. So we've worked very closely with United Way Worldwide to ensure that our fundraising matches that of other 211s across the country, and that we are working with a variety of different partners to look at sustainability. We do have staff that's committed to fundraising for all of our different program areas at United Way, and they'll be continuously fundraising every single year to support 211 and all of our other programs at United Way. In addition, the task force will include a fundraising group, so they'll be able to assist us in finding new partners that might be interested in investing in this opportunity. So even though we're closing in on our gap for year 1, we've started on year 2 and even year 3 funding, and we'll continue that. We'll just be constantly rolling into new years as we're looking to fund 211.
Thank you.
Mm-hmm.
And I've committed to Deanna and Steve that, make presentations to other groups of mayors. I think, I'm not unique. Every mayor in this county has experienced what we have, where we know we have residents struggling, and we don't know how to get them help or where to send them. So we're going to talk to other communities. So Gurnee is probably one of the early ones, but I think we're going to get a lot of other communities, and it's nice to see the county stepping up, which will encourage others to step up too.
One other thing I wanted to mention, which I think you might appreciate, which is related to funding. There's a little irony here. We're paying for this with video gambling money. I fought video gambling. I spoke against it. I work against it. I voted against it, but it's here. And the county has $500,000-$600,000 a year for video gambling money. One of the criteria for video gambling is does it address human services? Ironically, to help repair some of the damage that video gambling does. So in terms of financing, I can, as much as you can guarantee anything politically, there's a hard core of people on the county board who will vote to support this for many years to come.
All right, seems we have a consensus. Do I need
Make a
formal
motion.
vote? Do I need a regular vote? Okay, I have a motion by trustee Garner,
Second.
second by trustee Jacobs. Roll call, please.
Aye.
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 Yes.
Yes.
Aye.
All right. Yeah, to participate and contribute 10,000. All right, motion carries. Thank you very much. This means a lot to all of us that we can help our residents and get them help. It's going to be a big win. So, thank you. And that is the end of petitions and communications. So we'll move on to, we have no reports.
Just an update on the river. It's about a little over 8 feet. Looks like it's flattening out. So they've got about a half an inch of rain called for Wednesday. So we'll see if that materializes or not. But are in an okay position given the extended forecast at this point. So a lot of rain in the last week or so has obviously shot it up. So we'll continue to monitor it, keep the board updated if anything changes.
All right. Any old business?
No.
All right, we're going to move on to new business. The first item is approval of a request from 795 Depot Road for relief from the Gurnee Municipal Code, Section 66-135, which limits residential driveways to 1 per 65 feet of frontage measured at the property line. We do have the petitioner here tonight, too, Mr. May. But Patrick?
Sure. So 795 Depot is a vacant parcel on Depot Road. Currently, it's zoned R4, two-family residential district. So from that perspective, it's in a good spot. The proposal is to erect a duplex on the property. With duplexes, the two living units typically have 2 separate driveways. The proposed layout, the garages would be on the end, so the 2 driveways would be needed. So as I said, from a zoning perspective, it's in a good spot. The municipal code limits driveways to 1 per 65 feet of frontage. So based on that, to need 2 driveways, the math tells you 130 feet of frontage. This property has about 100 feet of frontage, so that is the relief that's being sought. The property to the south, directly south of it, is a duplex that has less frontage and it has 2 driveways. So the 2 driveways and a duplex on this property will be consistent with what's in the surrounding area. So as I said, the request is for that relief to have 2 driveways on the property with about 100 feet of frontage. Staff's reviewed. Staff is fine with it.
This is a good kind of relief that allows us to create some affordable units in town.
Move to approve.
Second.
Motion by trustee Ross, second by trustee Thorstensen. Roll call, please. Donna?
Aye.
Aye.
Abstain.
Yes.
Aye.
5 ayes, 1 abstain.
All right, motion carries. Congratulations, Mr. May. All right, next item, item number 2, approval of renewals related to the village's self-insured medical plan. We have the health insurance plan, stop-loss coverage, and then the administrative services only contract.
Yeah, Christine's going to walk us through this, and then also the next item on the agenda, number 3, the dental renewal. So.
Okay, good evening. So this year, the memo is pretty much the same as prior years, so trying to follow the same format. Overall, the insurance industry seems to have kind of calmed down a bit more compared to prior years. I'm anticipating that we will have complete this year with a very good year in 2018, and then that allows us to renew into 2019 in a very positive manner. So the proposals and the quotes received from Blue Cross Blue Shield were very good. Continues to be a solid plan. No benefit changes, no reductions. We are moving forward as we have in prior years. Most of the pricing is very competitive compared to prior years as well. We've had positive claims experience, so we continue to manage our plan well. Myself and our broker keep a watch on what's going on, and as we need to make changes, we do. But we anticipate a very positive year going into 2019 as well. So you have the pricing that's been laid out for our levels of coverage. We have no more Affordable Care Act fees for 2019. So there's some relief from that. We've made our final payments regarding any of those fees. And then our stop loss, which is like our deductible coverage for individual claims, and then as well as all or overall claims, remains competitive, with just slight increases. So those are very positive things. A lot of it is just adjusting due to changes in our employee population. So increases in dependents and family coverages will sometimes sway that rate, but again, very competitive. Pharmacy still continues to be the challenge. With most drug plans, it's still outpacing our medical costs, but we do try to keep that under control through plan design and different things going on in the industry. So we don't anticipate any changes for this next year. Staying with the Prime Therapeutics, which is the pharmacy benefit manager through Blue Cross Blue Shield. Again, our administrative services, Blue Cross does pay our claims. They administer the plan on our behalf as we are self-insured. So we'll continue to utilize their services. Their renewal rate was slightly less than last year. And then combined with some of the pharmacy rebates that kind of come into play, we again get a very competitive rate. The MD Live contract, we are going to continue for this next year. There's been some pricing adjustments. This will be our third year using this telephonic healthcare service. But as we go forward, I'm going to keep my eye on this. I'm not sure that we are getting the best benefit from what we could with this program, but obviously after only 2 years, it's a very short time period to really do a thorough assessment. So we'll be using this next year to kind of round out that assessment period and determine if we need to continue with it, change it, or go a different direction. So overall, we anticipate our claims to be very positive for the upcoming year, kind of projecting forward, knowing some of our insurance claims that we have currently, some things that may be resolving, and anticipating for unknowns. So I do believe that we'll have another positive claims year, and anticipating our recommended adjustment for our funding at 2%. And then continuation with our broker contract, which we have a perpetual contract with him unless there's any changes. He is not proposing any changes to his contract, so that would just continue for the next 12 months. I'll entertain any questions.
Questions from the trustees? If not, do I have a motion to approve?
So moved.
Second.
Motion by trustee Ballmer, second by trustee Jacobs. Roll call, please, Donna.
Aye.
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 Yes.
Yes.
All right, motion carries. Item number 3, approval of the group dental insurance renewal with Delta Dental. It's a 0% rate adjustment for 12-month period beginning January 1st, 2019. Christine, anything to add?
We've been happy with Delta. They've been great to work with, and obviously they give us good rate adjustments.
So moved.
Second.
All right, motion by trustee Jacobs, second by trustee Garner. Roll call, please, Donna.
Aye.
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 Yes.
Yes.
Aye.
Motion carries. Thank you, Christine. I
Thank
know
you.
this is hours and hours of work, and it just went kind of in 5 minutes.
There, yeah.
But you made it very simple for us, and you got good deals for the village and the staff, so thank you. All right, item number 4, approval of ordinance 2018-74,
74.
approving an intergovernmental agreement regarding regional 911 consolidation.
Sure. So this is kind of cross the Ts and dot the Is as it relates to our participation in the county's regional 911 consolidation effort. The intergovernmental agreement before you tonight discusses such things as how the contribution that the village made will be spent, the different committees that have been formed, hiring a project manager, bringing a consultant on board to assist with the project. A lot of this has already been completed. The project manager's on board. Looking at bringing the consultant on board, the policy and operations committees have been meeting, which we have a combination of village staff, myself, Chief Kavanaugh, Chief Woodside, and I, as Director Valcover, participate on the committees, so we're well covered there. So like I said, this is really just kind of wrapping it up. The IGA has been together, it's been circulated amongst all of the participating entities. They kept it high level on purpose because you've got 15, 20 communities that need to approve this thing, so they want everyone to have the same format, sign off on the same document. So, as I said, it's just kind of an after the fact, we're all in this together, approve the IGA and continue forward. So it's not committing us to anything beyond what we've already discussed at the village board level, and just kind of provides a summary of what the first stage is going to be here. So.
All right, there's no, and I'll repeat what Patrick said, no obligation on consolidation. We're participating and being at the table to see how this progresses.
Yep.
Make a motion to approve.
Motion by trustee Balmas, second by trustee Jacobs. Roll call, please.
Aye.
Yes.
Yes.
All right, motion carries. It's the end of our new business. I'll reopen the floor for public comment. Anybody'd like to address the board? All right, if not,
Mayor, can I make
Oh.
one statement?
trustee Thornton.
I just wanted to mention, I think you guys were in the parade, Gurney Days parade. Were you the ones that handed out the flags for the Exchange Club? There, I got mixed up with your troop number, so, but thank you very much for participating.
All right, if there's nothing else, do I have a motion to
moved.
adjourn? Motion by trustee
Second.
Balmas, second by trustee Garner. All in favor, say aye.
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 We are adjourned.